Have you ever woken up with that awful feeling that the world is spinning? That the simple act of getting out of bed makes you feel like you're on a boat in the middle of a storm at sea? If you or your elderly loved one is over 60, that sudden dizziness might not just be a temporary issue. It could be the start of something much more serious. But here's what many doctors don't tell you. The way you lie down in bed could be silently triggering episodes of vertigo that seem unexplainable. And the most surprising part, we've discovered that there's a specific position that practically eliminates this risk. Something so simple, you'll wonder why nobody ever told you about it before. According to recent research from the Mayo Clinic, more than 40% of Americans over 65 will suffer from episodes of vertigo that can lead to serious falls. As a doctor specializing in balance disorders for over 23 years, I've seen an alarming pattern. 7 out of 10 elderly patients who come to my office complaining of dizziness and vertigo are, without realizing it, making their symptoms worse by the way they lie down to sleep, the G knows. Small adjustments in sleeping posture can drastically reduce these episodes or even eliminate them completely. Today, I'm going to share with you the 5 most dangerous positions for seniors to lie down in bed, those that silently contribute to intense vertigo attacks, and most importantly, I'm going to show you what to do instead. This information is so valuable, it can literally transform an elderly person's quality of life overnight. According to experts at Johns Hopkins Medicine, vertigo isn't a punishment of aging or something you simply have to put up with in most cases. It's a completely treatable problem when you understand its true causes. Let's start with the 5th most dangerous position that seniors should avoid when lying down. The 5th position that seniors should avoid is lying flat on your back with your head completely straight and without any kind of elevation. Sounds harmless, right? After all, many of us were taught that lying flat is ideal for the spine. However, for people with a predisposition to vestibular problems, this position can silently worsen circulation and pressure issues in the inner ear region, where our delicate balance system is located. Rosa, a 68-year-old retired nurse, came to my office after 3 months of suffering from unexplained morning dizziness. "Doctor, I always took pride in my perfect sleeping posture. I lie down like a mummy, completely flat, without a high pillow, because I thought it was best for my spine. But in recent months, it's been a nightmare. I wake up and the world seems to be spinning. I've already fallen twice trying to get out of bed," she reported, visibly frustrated. What Rosa didn't know is that our vestibular system, the labyrinth responsible for balance, works like an extremely sensitive gyroscope. When we lie completely flat, especially after age 60, when there's naturally a decrease in cerebral blood flow, the fluids in the inner ear can accumulate unevenly, creating abnormal pressure on the hair cells that detect movement. According to studies from Harvard University, this position can also facilitate the displacement of otoliths, tiny calcium carbonate crystals that are part of the balance system, especially during REM sleep when rapid eye movements occur. It's as if you had loose pebbles inside a precision device. Any sudden movement can cause an incorrect reading of motion, resulting in that terrible feeling that everything is spinning. To solve this problem, I suggested Rosa slightly elevate the head of the bed, about 15 degrees, or use a firm pillow that would keep her head slightly elevated. "Doctor, can something so simple really make a difference?" she asked skeptically. 2 weeks later, Rosa returned for a follow-up, and the transformation was visible. It's like someone turned off a switch. The morning dizziness practically disappeared. This simple change reduced pressure on the vestibular system and improved cerebral blood circulation during sleep. However, it's important to note that the elevation should be moderate. Pillows that are too high can cause neck tension and spinal misalignment, creating a new set of problems. Look for a gentle elevation that allows your head to be naturally aligned with your spine, just slightly higher. Let's now move to the 4th position that seniors should avoid when lying in bed. The 4th problematic position is lying on your side with your neck twisted and poorly aligned with your spine. This is one of the most common positions and, unfortunately, one of the most harmful for those suffering from vertigo. When the neck is twisted during sleep, compression of the vertebral arteries occurs, which are responsible for supplying blood to important areas of the brain, including the cerebellum and parts of the vestibular system. Carlos, a 61-year-old retired salesman, came to my office practically desperate. "Doctor, I wake up every day with the feeling that I'm on a carousel. I've tried everything, medication for labyrinthitis, herbal teas, even acupuncture. Nothing works. The worst part is, that this is preventing me from playing with my grandchildren. I'm afraid of falling with one of them in my arms," he said with tears in his eyes during our conversation. I discovered that Carlos had the habit of sleeping on his side with a very soft pillow that would sink during the night, leaving his neck completely crooked. It's surprising how something apparently so simple can have such serious consequences. To better understand, we need to know the anatomy of the region. The vertebral arteries pass through small openings in the cervical vertebrae. When the neck remains in an unnatural position for hours, these arteries can be partially compressed. According to research from the National Institute on Aging, this prolonged compression reduces blood flow to the vestibular system by up to 30%, which is enough to trigger vertigo symptoms in the morning. Additionally, this position can also stress the proprioceptors in the neck, specialized receptors that inform the brain about the body's position in space. When these signals get confused with information from the vestibular system, the result is that disorienting sensation of movement when, in fact, you're standing still. The solution for Carlos was simple but extremely effective: investing in a firm orthopedic pillow, specially designed to keep the neck aligned during side sleeping. "Think of your neck as the bridge connecting your brain to the rest of your body," I explained. "If that bridge is crooked, all the messages passing through it get compromised." I also recommended that he place a pillow between his knees to keep his spine completely aligned during sleep. In just 3 weeks, Carlos's vertigo episodes decreased dramatically. "It's incredible, doctor. I spent a fortune on complex treatments, and the solution was literally under my head," he said at our follow-up appointment. It's important to mention that if you sleep on your side, the ideal pillow should have exactly the right height to keep the cervical spine in a straight line with the rest of the spine. Not too high, not too low. It should perfectly fill the space between the shoulder and the head. Now, let's move to the third position that seniors should avoid to prevent vertigo attacks. The third dangerous position for seniors is sleeping on their stomach with their head turned to one side. This might be the most controversial of all, because many people swear by this position and claim they can't sleep any other way. However, from a medical standpoint, especially for those over 60 with a predisposition to dizziness, sleeping on your stomach is like asking for trouble. João, a 64-year-old former truck driver, came to my office with a desperate plea. "Doctor, I've slept on my stomach my whole life, but now, every morning when I wake up, the world won't stop spinning for at least an hour. My wife is threatening to put me in separate rooms because I almost hit her during one of my dizzy spells." The problem with sleeping on your stomach is multifaceted. First, to breathe, you're forced to turn your head to one side, maintaining extreme neck rotation throughout the night, often for 6 to 8 hours straight. This prolonged rotation creates severe compression on one of the vertebral arteries while excessively stretching the other. According to the American Academy of Physical Medicine and Rehabilitation, this sustained position can reduce blood flow to the posterior brain by up to 25%. But there's more. This position also puts direct pressure on the temporomandibular joint, the jaw, which is intimately connected to the inner ear through a series of nerves and muscles. Chronic pressure in this area can create referred sensations in the vestibular system, contributing to episodes of dizziness. Additionally, sleeping on your stomach often forces the lower back into which can trigger a chain reaction of muscular and postural imbalances that affect the entire body, including the equilibrium system. For Joe, transitioning away from stomach sleeping was challenging. After all, it was a habit of over 60 years. We implemented a gradual approach. First, I placed a body pillow in front of him, forcing him to sleep at least at a 45-degree angle instead of completely flat on his stomach. Gradually, over 6 weeks, we moved him to complete side sleeping with proper neck support. I won't lie, doctor. The first 2 weeks were tough. I felt like I was learning to sleep all over again, Shuang confessed. But now, 3 months later, I wake up without dizziness, without that awful feeling. And you know what? I actually sleep better now. If you're a stomach sleeper reading this, I know change seems impossible. But consider this. Is temporary discomfort worth it if it means eliminating those daily episodes of vertigo? The answer for most of my patients has been a resounding yes. Now let's discuss the second dangerous position. The second position that can trigger severe vertigo in seniors is sleeping with your head lower than your body, whether it's from a pillow that's too flat, sleeping without any pillow at all, or even sleeping with your feet elevated without proper head elevation. This seemingly innocent position can wreak absolute havoc on your vestibular system. Anna, a 72-year-old retired accountant, arrived at my office with an unusual complaint. "Doctor, I've always followed health advice. I even raised the foot of my bed because I read it helps with circulation. But instead of getting better, I started waking up with terrible dizziness and a pounding sensation in my head. What Anna didn't realize is that elevating your feet without proportionally elevating your head creates a scenario where excess blood pools in the cranial region, including the inner ear. This increased pressure can overwhelm the delicate hair cells in the vestibular system. To understand this better, imagine the vestibular system as a series of fluid-filled canals with microscopic sensors. When your head is lower than your body, these fluids don't just sit quietly, they shift and create abnormal pressure patterns. According to research from the Cleveland Clinic, this can increase intracranial pressure by up to 15%, which is significant enough to trigger vertigo, especially in people whose systems are already compromised by age. Furthermore, this position makes it harder for the heart to efficiently pump blood back from the head, creating congestion that can persist even after you wake up. The solution for Aina was straightforward. We adjusted her bed so that both ends were slightly elevated, creating a gentle incline that still helped with leg circulation but didn't create a head-down position. Within 2 weeks, her morning vertigo disappeared. "It's amazing how something so subtle made such a huge difference," she commented. "I feel like I've reclaimed my mornings." This brings us to an important principle in managing vertigo. Your head should always be at the same level or slightly higher than your body during sleep. Never lower. This simple rule can prevent countless episodes of dizziness and the falls that often accompany them. And now, for the most dangerous position of all, the one that's responsible for more emergency room visits related to vertigo than any other single cause. The first and most dangerous position that can trigger severe vertigo in seniors is changing position abruptly during the night or upon waking, especially going rapidly from lying down to sitting or from sitting to standing. This is, without a doubt, the most common and devastating trigger for vertigo attacks in people over 60. Maria, a 58-year-old retired teacher, came to my office, literally leaning on her daughter, unable to walk alone due to the intensity of her symptom. "Doctor, this started 3 months ago. One morning, the alarm went off. I sat up quickly in bed like I always did, and suddenly, it felt like I was in a center. I vomited instantly and couldn't get up for almost an hour. Since then, I've been afraid to even move in bed," she described, visibly shaken by the experience. What happens in Maria's body and in thousands of seniors is a combination of factors that intensify with age. First, our cardiovascular system becomes less efficient at compensating for rapid position changes. When we stand up abruptly, blood pressure needs to adjust quickly to ensure the brain continues receiving sufficient blood. After age 50, this adjustment becomes progressively slower, a phenomenon called orthostatic hypotension. According to CDC experts, this delay can cause a momentary reduction of up to 40% in cerebral blood flow, directly affecting the functioning of the vestibular system. Additionally, sudden movements can displace the otoliths in the inner ear, those tiny calcium carbonate crystals essential for balance. Imagine your vestibular system as a delicate bubble level used in construction. With age, the bubbles of the otoliths can break loose from their ideal position. Sudden movements are like violently shaking that precision instrument. The reading becomes chaotic, resulting in the sensation that the world is spinning. Treatment for Maria began with an approach I call the 3-moment technique. First moment, upon waking. Remain lying down for 30 seconds, breathing deeply and moving only your eyes and fingers. Second moment, slowly turn to the side of the bed, still in a horizontal position, and remain like this for another 30 seconds. Third moment, use your arms to push yourself into a sitting position, keeping your head aligned with your torso, and remain sitting on the edge of the bed for at least 60 seconds before attempting to stand. This slow transition allows your cardiovascular and vestibular systems to gradually adjust to the position change. I explained to Maria, it's like giving your body time to recalibrate its internal GPS. I complemented the treatment with specific vestibular rehabilitation exercises, a therapy recognized by the American Academy of Neurology as highly effective in treating vertigo. A month later, Maria returned for follow-up, walking alone with a radiant smile on her face. "Doctor, I thought my active life was over, that I could never travel again or play with my students. But following this slow movement routine transformed my life. Now that you know the 5 most dangerous positions for seniors when lying down, lying completely flat without elevation. Lying on your side with a twisted neck, sleeping on your stomach with your head turned, keeping your head lower than your body, and changing position abruptly, you already have powerful tools to transform your quality of life or that of your elderly loved one. As we've seen through the stories of Rosa, Carlos, Joana, and Maria, seemingly small changes in how we lie down and get up can have an extraordinary impact on vertigo control. Vertigo isn't a house arrest sentence for seniors. nor a punishment of aging that we must passively accept. In the vast majority of cases, it's a completely manageable problem when we understand its true causes and adopt the right strategies. Remember, your vestibular system is like a high-precision instrument that, with proper care, can continue functioning harmoniously throughout life. Don't underestimate the power of a simple adjustment in sleeping position. This can literally be the difference between living in fear of falling with every step or rediscovering the freedom of movement you may have forgotten is possible. You might be wondering, so now what? Where do I start? The answer is simple. Start tonight. Make a small adjustment in your sleeping position or that of your loved one. Maybe an ergonomic pillow, a gentle elevation of the headboard, or simply a commitment to get up slowly in the morning. Observe the results for a week, and like Rosa, Carlos, Johanna, and Maria did, you'll probably be surprised by the difference such a simple change can make. And remember, prevention is always the best treatment. Don't wait until the serious fall happens to start taking vertigo seriously. How would you feel knowing that a simple change in sleeping position could be protecting you or your loved one from a hip fracture, which according to the CDC, reduces life expectancy in seniors by up to 20%. Wouldn't it be wonderful to wake up without that terrible dizzy feeling, ready to enjoy every moment of the day with confidence and energy? If this video helped you better understand how to prevent vertigo attacks in seniors, please leave your like and subscribe to the channel. Your questions and experiences in the comments are extremely valuable to our community. Do you know someone who suffers from vertigo or dizziness? Share this video, you might be changing that person's life. And don't forget, small changes, big transformations. See you in the next video.